Okay, so let's look at some of these different medical problems. So, I mean, these are fairly substantial. If you added them all up, all the people who are paralyzed, they're either quadriplegic or paraplegic, all the people that have chronic pain, addiction, I don't know if you could deal with Alzheimer's, but certainly Parkinson's and stuff. I mean, it must be millions of
It
people.
is. It's billions of people. And I think one of the sort of education points that I have around BCI is that a lot of people understand, oh, okay, prosthetics like Robocop, control robotic body, get robotic eyes, that makes sense. But a lot of the big wins, in healthcare and commercially from BCI will be reading cognitive and mood states. So think about
Hmm.
like if you go into the doctor, a simple question like, how much pain are you feeling? 1 to 10. Everyone hates that question. No one knows how to report it. And like if you ask my Nana about how much pain she was recording, she'd have a compound fracture. She'd tell you it too. And then I also have friends that
Yeah.
they're just feel like their pain levels after a hard day at work is like an 11. And so it's hard to normalize. And how do you decide who should be on opiates in an environment like that? And
Right.
so, one of the things that I'm really excited about for BCI is it can read out things like mood, pain, cognitive states, and then imagine instead of having to just go into a psychiatrist's office or a neurologist's office and fill out a checklist, it had just an objective readout of what was going on in your brain, and it could tell you this drug is working for you, this drug is not working for you. Hey, you could have a phone app that says in the next 20 minutes, take one small blue pill and one large red pill. It could. It would really transform how people treat mental health in the same way that continuous glucose monitors changed the way that people treat diabetes, even though all it does is measure.
All right, let's carry this out a few years. Can you imagine either your company or maybe you're contracted with a medical hospital or whatever center in which whatever the person walks in with, I have chronic pain or I have severe depression or whatever. Okay, we're going to scan your brain. We're going to do this. We're going to put these little chips in here. We know exactly what to do. So it would become just kind of a clinical practice.
Oh, absolutely. That's where it's going. Yeah.
How long?
We're looking at we're aiming for commercial approval in 2030. So,
All right. Okay.
the first applications, the first people walking in with conditions and getting prescribed devices will be in the 2030s. And then it's just, expanding from there. Our goal is not only running our own clinical trials, but to get devices out to the leading clinical researchers in the field and have them run academic trials and essentially just continuously find new applications and new things and people that can help with the devices.